Okay, the paradigm shift in treating brain injuries and PTSD. At our facility, we're able to do advanced research, metabolic testing, and treatment protocols. Right now, we're able to change the paradigm and actually customize the treatment protocols based on individual metabolic markers. Current treatment protocols from this Time magazine article is medicating the troops with Prozac and Xanax. We're not saying they don't need Prozac and Xanax, but there's other parts of the body that we could be looking at. 5 to 20% of the men have post-traumatic stress right now, along with brain injuries, traumatic brain injuries. We can actually change the paradigm on the treatment protocols. We can customize the treatment protocols for these troops, looking at, again, multiple metabolic markers, using our imaging and our MRIs. Divorce, prescription drug use, narcotics. We have to do a better job at helping our troops coming home. Just talk therapy isn't enough. We have to dive inside their metabolism, look at metabolic markers. We have to train the counselors to better handle these guys. Look at the rise of illness, post-traumatic stress, cancer, depression, psychosis, impaired immune system. By looking at multiple metabolic markers on these folks coming home, we could actually develop programs inside of hospitals so we could take care of the amount. There's going to be a large amount of veterans coming home that are going to be needing help, and we just don't want to medicate them and push them to the side. We want them in treatment programs where a facilitator or the physicians are actually trained to doing this advanced testing. So our mobile units are available here in Central Florida, and also we could plug this into a hospital in a turnkey solution pretty quickly, or the Veterans Administration. Psychological wounds, 18,300 soldiers were screened at 3 and 12-month intervals following deployment to Iraq. PTSD rates now range between 20 and 30%. We actually look at elevated cortisol levels with some of our saliva samples, and the elevated cortisol impacts the brain chemistry and damages the neurological architecture. We also did studies with the drug company. Irving Kirsch looked at the studies for 13 years on the most common used antidepressants, Zoloft, Effexor, Paxil, and Cerazone, and found that in 56% of the studies, they were no better than the placebo. So just knowing this, we have to offer a better program to the troops. And even if you watch TV and see that commercial for Abilify's commercial says, if your antidepressant isn't working, and they list these same antidepressants, they say try Abilify. Well, what we're saying is, why don't we look at cortisol levels, the thyroid, hormone levels? Why don't we look at the intestinal tract? There's other metabolic markers that we could be looking at to turn these troops around, to turn their metabolism around and help them heal, whether it's from a brain injury or PTSD. There it is. That's what they're utilizing. Prozac is a hot topic. We have to look at other metabolic markers. Since the Civil War, we've been tracking this. The DaCosta syndrome shows us that you can't cut the head off the body. You have to understand that when you're under stress, multiple parts of your body start to break down. Multiple systems of your body is all impacted just from being in the stress response. The toxic environment. Our group also measures how the toxic environment impacts the body of a veteran, impacts the recovery from a brain injury patient. Remember, all the toxins in the environment impact our metabolism. This is part of the healing process to be able to turn this around. First, we detect it with the testing, and then we plug in a protocol to remove the toxins from the body. All this impacts the brain chemistry. This is the current treatment protocols: medication, talk therapy, debriefing. Current treatment protocols really don't take into consideration of impacting the whole body. Current treatment protocols basically cuts the head off the body. We know in order to treat the head, you have to treat the whole body. Now with our imaging, we could look at the brain through MRIs, we could look at the cardiovascular system through our echocardiograms, through our sonograms. Then we could build protocols incorporating nutritional deficiencies, hormonal deficiencies, advanced imaging, and really put these people on a protocol that works. Looking at multiple metabolic markers at our facility, advanced imaging, metabolic testing, nutrition, hormonal support, all allow us to customize treatment protocols for traumatic brain injury patients and the healing process, to speed the healing process, as well as post-traumatic stress. The intestinal tract, the hormones, and nutrition all impact brain chemistry. This is all part of the healing process. Current treatment protocols include antidepressants, antipsychotics, and sleep aids. We're not saying these things are bad, but only used for a short period of time. To get the body back in balance, we have to look at other metabolic markers in order to heal these troops. We know that certain antidepressants damage the prefrontal cortex over time. Dr. Peter Bregan, who wrote the book Toxic Psychiatry, have these studies in there. Just being aware of that, we have to be real careful with distributing this medication. If we're all biochemically unique, a lot of the people with traumatic brain injuries or post-traumatic stress will not react the same to the antidepressant protocol.